The fifth Community Healthcare Dialogue in the ongoing series sponsored by Dr. Richard Merkin, President and CEO of Heritage Provider Network and Sierra Medical Group, took place November 15th in Palmdale, California. The Honorable James Ledford, Mayor of the City of Palmdale, moderated the panel.
Today, we're really here to talk about this new healthcare legislation. Now, we know that we may not have an answer for where that may go, but I think we have some insight, some ideas, and that's hopefully what we'll get out of our panel.
Panelists included Dr. Tuan Phan, Medical Director, Sierra Medical Group, member of the HPN family, Dr. Karanyan Arul, Medical Director of the Antelope Valley Community Clinic, and Mr. Robert Troutman, CEO of Lancaster Community Hospital and Palmdale Regional Medical Center. Co-sponsored by the Palmdale Chamber of Commerce and the Palmdale Regional Medical Center, over 100 people attended the luncheon event to learn more about how the new healthcare legislation has already impacted their community.
People who are very sick cannot be dropped from coverage. There is no lifetime limits of coverage are being stopped. The pre-existing conditions, people who can't find insurances are being allowed to be insured. Children can stay on their parents' insurance for a longer time. So bottom line is they provide more coverage through insurance mechanism for those who are sick and those who are unable to pay.
New legislation will bring to us new challenges. With the electronic medical record 100% fully implemented, and with our customized patient education on the implementation that our Sierra Medical Clinic, I think we can meet the challenge.
I think what the current proposals provide through accountable care organizations is an opportunity for the physician community and hospitals to work together with common goals and objectives. And that's something that has never been aligned in the past, surprisingly, particularly in community hospitals. So that is a great opportunity that can not only serve the provider community and people in the local regions, but also aligning objectives will raise the bar as it relates to quality.
There's a lot of thought about this legislation, but here's some reality for us to kind of put it all in perspective. Los Angeles County, ground zero in the country for uninsured. 1 in 4 under 65 is uninsured. According to Professor Gerald Kamenetsky, UCLA Project for Health, the projection for AV could be as high as 25% uninsured by the end of this year.
Our estimate is about 70,000 people in the Antelope Valley are without insurance or are underinsured or get their care through emergencies and do not have access to the preventive care and the pre-emergent care that is so important to people. So that's what we've been doing. And the Antelope Valley Community Clinic now, we take people with insurance, without insurance, anyone who walks in, we take.
Well, there's certainly a benefit with the uninsured being covered. That eliminates bad debt. And another issue we must face is in a community such as this, where we're already underserved by physicians and hospital beds, the accessibility for those patients who have newly created insurance available. Are we going to be able to handle that burden?
I believe that quality of care will lead to efficiency of care, and that would turn to a lower cost and eventually result in more coverage.
As we move forward as an Antelope Valley, we can tell our residents have gone through a lot as far as access to health care.
We have in Antelope Valley the worst outcome indices, the highest number of diabetics, highest number of diabetics who have complications, highest number of people who smoke, highest number of childhood obesity, and we are number 1 in all of those things.
There's not many organizations that would develop a nearly $300 million investment for a return that's around 5% is what we're anticipating. That's a pretty risky proposition, but it's a community need, and it's a fact that we're an underserved area, the demand is there, so we have to run efficient, and that's what we're all talking about.
We can solve it only by getting together and collectively, including the business community, trying to achieve it as a group and as a community.
We define quality of care or primary care as a care would be comprehensive, continuous, and coordinated, but also lastly accountable. Healthcare now, surprisingly, is fragmented. Primary care never talk to hospital, hospital never talk to primary care, and there's nothing, no bridge built in between. Let alone we talk about cooperation or talk about collaboration, and we talk about any co-management of the patient care in that line. So I think that the must in order to survive the future. I think hospital and outpatient care should form an alliance or some sort of co-management of outpatient care.
Not only did the community respond positively to the event, press coverage recognized the importance of the community healthcare dialogue. And Mayor Ledford has a suggestion for Dr. Merkin.
I thought this was great, but what this told me is we need to do more of this, because I've had people that have questions, they'd like to have more of a discussion. So this may be just the first of many.